we're joined by our special newsmaker on the 8 o'clock news tonight. I'm joined by Dr. Angelique Coetzee. She's a physician in South Africa and also chairperson of the South African Medical Association. But of course, also the doctor who first raised the alert over the Omicron variant. Dr. Coetzee, thank you very much for joining me this evening on NDTV. I just wanted to ask that you actually have had first-hand experience of seeing patients with Omicron. Tell us about how you first spotted this and what you identified as the symptoms.
Good afternoon, and maybe it's good evening at your side.
Yes.
Yeah, so I think it's important to understand that when we first now starting to see these patients, it's mild symptoms. It's not the same symptoms than you normally will see with the Delta variant.
Mm-hmm.
What we call mild symptoms is like, fatigue, sort of a scratchy throat. It's not really a sore throat. Nothing with the nose really going on. They're not complaining any of with stuffy noses. And what we call body aches and pains and a bit of a headache.
Mm-hmm.
So that would also fall under the term, medical term malaise. That's, and not really having a temperature. I've seen about 2 children with a temperature,
Mm-hmm.
but it's mild symptoms and totally different from your COVID, your Delta variant. And I think what is important to understand when we say this is mild symptoms, we're not saying you don't need to go to the doctor. We're actually encouraging you to go and see your healthcare worker to make sure that these symptoms that you think is actually not of any importance might be the Omicron already been there, and you might spread that variant
Mm-hmm.
to other people who is unvaccinated and cannot afford it. So when we say it's mild, yes, we are saying, please don't be at this stage too alarmed that everyone is going to die from this variant. But also don't just think this type of infection I have will just get better on its own.
Right.
Please go and make sure. That's the reason why we keep on saying it's mild symptoms as well. One of the reasons.
And Dr. Coetzee, because as you said this, the World Health Organization today issued a statement warning that consequences, the worries of transmission of the Omicron virus could be very severe if we let it go uncontrolled. This comes, of course, when we're seeing country after country imposing very severe travel restrictions, especially against South Africa. Do you think that's really the right response? And actually the data coming out of South Africa is what has worried people in India as well, that in some provinces the Delta variant is being replaced by the Omicron variant in a very short span of time. So the transmissibility, even though mild, seems very high.
Yes. We're not disputing the transmissibility. We think it is maybe, for now it's difficult for me, that's a clinician, to say it's worse than the Delta variant, but it's just as transmissible than the Delta variant, at this stage of the game. And the scientists will tell you it might be more, and that's fine. The fact it is transmissible, and it's more than the Beta variant was before. So the severity of the disease, it depends on, and I think this is where the whole confusion or the whole hype is coming in, because of the 30-odd mutations it's got. People don't know what to do with this virus. They don't know what's going to happen going forward. We can only say to you what we are currently experiencing. And so within the next 2 weeks from now on, we will know with the data that we would then have, is it escaping the vaccines?
Mm-hmm.
Is it escaping our acquired immune? And do you see only breakthrough infections not really escaping the vaccines, or people who had been previously infected? What is the reinfection rate? And if it's reinfected, how bad clinically these patients would be? Right. So in the end of the day, it goes about how severely affected people are who would be in need of hospitalization. So the mere fact that we say it's a mild disease doesn't take it away that you're not going to feel sick. You are going to feel sick.
Mm-hmm.
but it seems to be very much self-limiting. If after you have told the patient what to do, and you assist the patient.
Right.
But for now, we don't see that there's oxygen needs or ICU needs. It's not there yet on the type of patients that we encounter at the primary care level. I'm not talking about patients lying in hospital and whether they are already being sorted as whether it's Delta or Omicron. That's hospital level, but we also haven't seen an increase in hospitalization.
So that's a very encouraging sign. You're saying that right now, and of course, you chair the South African Medical Association, that at the primary healthcare level, and even in the rate of hospitalization, you're not seeing a surge similar to the surge we're seeing of cases. So hopefully that may be a silver lining.
That might. And it might stay like this. And it might change within the next 48 hours.
Right.
But that is this type of virus that we're working with. And so we're just saying to the world out there, listen, yes, we know we see these people. We know our infectivity rate is going up. But let's step one step back, take one step back, and let us just see what is going to happen before everyone go into a hype, closing borders, affecting other people's lives. And we still haven't worked this out. And it's not a South African disease. It's a world over disease. I'm quite sure it's in other countries as well. And we have already seen reports coming from other countries that it's there.
Yes.
So, but because South Africa spoke up and told the world what we are seeing, and then again on clinical level at primary healthcare, we're saying, guys, what we are currently seeing is not in relationship with the hype. We're not saying it's not going to change.
No, and that's the right thing to do. The transparency, I think, is something that you need to, South Africa and the doctors like you need to be praised for, not something which is seen as a punishment. And I think the irony perhaps, Doctor, also is that when we looked, the world's attention is suddenly being drawn to Africa and the vaccination levels, even though South Africa is relatively higher than other African countries. And I think that's the point, that as a doctor, when you see that certain countries, richer countries have vaccines, make sure their population gets it and other countries are left out. That's what happens today then. And you then look at global shutdowns because, of course, people travel and citizens travel to other countries as well. So you can't safeguard your country without making sure there's equitable vaccinations. Did you see Omicron more in unvaccinated people rather than vaccinated? Is that just from initial data so far?
So far, yes, especially today, seen it in younger people. I've seen 3 people under the age of 13. Not very severely ill. They're not, they're not feeling well, but they're not deadly sick. And and I sent them all home, and I think we can manage them at home. We will follow up tomorrow and see how the children are. And then the other people were young people under the age of 40 that I've also seen 2 new ones there today. Again, not very severely ill, but it might change.
Right.
So we're trying to say, don't miss these people while you are looking for Delta signs, and you actually miss the Omicron, which might spread quite fast, which might bite you going forward because you didn't look at the symptoms.
So you would say that people must get vaccinated even with current vaccines available, because that would help. And of course, this important point that it is getting picked up in COVID tests, that you are COVID positive even if you have the Omicron variant.
I really think so. At this stage, you need to vaccinate. You need to wear your mask, stay away from crowds, stay away. And that is the simple things that we have been saying how many times before. And people don't really hear what we are saying. And if your country's got a policy that you need to go and get a booster vaccine, go and get it. That's your country's policy. There's no guarantees that if you take the vaccines, you will never get sick. But we're trying to get people out of hospital. We're trying to say the vaccines are there to prevent you from getting severe disease. The vaccines are there to try to keep you healthy so that you don't die and that you get mild disease, so that we at primary care level can treat you with those mild disease.
Dr. Coetzee, as I said, this is a time when you're really in the eye of the storm, but I know that you are at that every day at the front lines, all primary healthcare workers and hospital workers. Thank you very much for joining me tonight from South Africa. It was it is a fascinating discussion, and thanks for your first-hand perspective. Thank you once again.
Thank you so much, and please stay safe.